Hello dear students. Today we're gonna talk about actinic keratosis. First, we have the definition. It's a scaly rough patch on your skin, appears in your skin of face, lips, and around the ears, neck, and scalp. Also known as solar keratosis because when you expose to sunlight, you will suffer from it. These patches take years to develop, usually appears in over 40 years. A small percentage of actinic keratosis lesions can eventually become skin cancer. You can reduce your risk of actinic keratosis by minimizing your exposure to sunlight and UV rays. Symptoms. As we mentioned, it's a rough, scaly patch on your face or lips or around the ears. It's usually less than 1 inch, flat or raised, in some cases hard and warty-like surface. The color is range from pink to red to brown, as we see there. You may feel like itching and burning sensation in the affected area, sorry. Actinic keratosis found primarily on lips, skin, and forearms. In this pictures, we see that this scaly patch on your lips and this around his ears. This picture of this patient after 4 weeks treatment of actinic keratosis. When to see a doctor? It can be difficult to distinguish between non-cancerous spots and cancerous ones. As we mentioned before, it can be a skin cancer. So it's best to have new skin change evaluated by a doctor, especially if spot lesion persists, grows, and bleeds. Causes and risk factor. The main cause is prolonged exposure to sunlight and an increased frequent and intense of the exposure. The risk factors that contribute to raise the risk of being affected. Anyone older than 40 years old, live in sunny places, have history frequent intense sun exposure, have red blonde hair and blue or light colored eyes because it's more sensitive to light, have weak immune system. How to prevent yourself from suffering from actinic keratosis? Limit your time in the sun. Take your cover up. Use your sunscreen to protect your eyes. Avoid tanning bed. Check your skin regularly and report changes to your doctor. Lastly, the treatment. An actinic keratosis sometimes disappears on its own, but typically return after more sun exposure. So the doctor may prefer to prescribe you some creams, such as Fluoroplix, ingenol muriate, diclofenac gel. These creams may cause redness, scaling, or burning sensation for a few weeks. Lastly, thank you for listening and take care.